HPCSA and welcome to BITS University. We are on Education Campus. My name is Zinia Banting and this is my colleague Peter Fourie and we are the interns of 2020. So today we're going to be running through the facilities on our campus.
So just to give you a brief overview, we're just going to show you guys that this is where the sports clinic is. And we also have one set of the lecture offices upstairs over there. We also have lecture offices there where the stairs are. And then we have lecture rooms where the lectures are given to students through the doors on the top on the first floor.
Right, and on the ground floor, we've got access to the swimming pool. We've got 2 lab rooms, lab 1 and lab 2, and 3 gyms, one for group classes, one for our gym members, and another for our athletes. And outdoors, we've got 2 fields where we can do outdoor training for our patients as well as for the athletes. And we will be running through each of these facilities in detail further in
Hi guys, so this is now the first lab that we use just to do some patient assessments. So we can either use the space over here or we can use the private office of the interns. Just coming here to the table and the chairs, this is where we do the history taking of the patient with some body measurements and some glucose testing or cholesterol testing. We can use the plinth over here to do some special tests, functional tests, and some manual muscle tests for the patient. For VO2 max testing, we can either use the watt bike or we can use the arm over, depending on what the patient feels comfortable with. Coming over here, we have the sternometer that we use to check the patient's weight and their height. We have some extra equipment that we can do other testing with. We have the posture analysis board that we use for posture assessments for our patients just to check if everything's alright with them.
So apart from using this lab for assessments that we conduct on our patients, we also use this lab for the students for them to do a lot of their practicals. So over here we've got Bob the skeleton as well as other models such as the heart, which the students can use to practice anatomy. We also have access to a number of equipment that they can use.
From the beginning of the year, students and staff members are informed about the emergency procedures that we have here at the campus. As you can see, we have posters posted all around the room just in case. We also have a fire extinguisher available for case of any emergency. Over here is the first aid station. Always regularly check just in case it needs to be used. All ventilated, as you can see with the windows and the doors. Many Wi-Fi routers available around the campus so that students and staff members have access to Wi-Fi. You can easily access the lab, and if need be, if they need to go towards the pool, there's also a sliding door with a sliding gate with a ramp that leads out towards the pool.
Welcome to our second lab. This is called our Biodex lab. As you can see, it is easily accessible for our individuals with disabilities. So coming into the lab, we've got our table over there as well as our private office, which we can use to conduct assessments with our patients, usually for history taking. As we come over here, starting on my right, we've got our plinth. This is where I conduct manual muscle testing and special testing for my patients. Underneath the plinth, so that it's out of the way, I've got my aerobic step, which we use to conduct step tests as well as exercises for our patients. We've got the sit to reach equipment over here, used to test flexibility of the hamstrings. Right, coming around the room, our other equipment is our Swiss ball. We've also got our mat as well as medical waste bins to get rid of any waste that we acquire. Usually it's our glucose testing strips, right? As we come over here, we've got our monarch bike, which we use to do our physical work capacity tests. We've also got another one in that corner, right? We've got our Biodex balance test, which we use for our neurological patients as well as our elderly patients, just to see how their balance is. Right here, as I mentioned, we've got the monarch bike. And over in that corner to my left, we've got the watt bike, which we do our VO2 maxing tests. Over here, we've got our water aerobics equipment. So it's easily accessible because we just go through our sliding door over here and it gives us access to the pool. As part of our assessment, we use our stadiometer as well as our scale just to check weight and height of our patients. Coming back over here to our table, got VO2 max testing equipment, our oxygen equipment. Then we've got our TechnoGym treadmill. So we use this to do a normal treadmill test. We use it for ECG testing to conduct our stress tests, as well as Bruce protocol, modified and normal. Over here to my far left, we've got our Biodex machine called the isokinetics machine, which we use for testing as well as exercising our patients. This is usually for our orthopedic patients.
Good.
Okay, so in this lab, we also have access to additional specialized equipment. So over here, we've got our lung function equipment, which we can use on our patients, as well as the students to practice how to do these tests. Over here, we've got equipment for our speed and agility training. We've got cones, we've got speed parachutes, and ladders.
Okay, so guys, this is now the Scots Gymnasium where we use this big open space to do student practicals and for group class activities. For student practicals, we've showed them how to use the Zephyr system on basketball players, so we can do testing in here. We're using that equipment. We've done plyometric testing using the plyometric mat on a nice hard surface. And we've also just done other kind of practicals such as manual muscle tests and special tests using the open space with some dumbbells and other equipment that we can do, that we can just show them around with. For group classes, we do the bodyworks class where we just do some general fitness with some of the patients that come in or the gym members. We do lower back classes as well where we focus on the core, so we can so people that struggle with lower back issues, they can come in and do some classes. And then we also have 4 wrist classes that we also come and do here with the elderly that have balance issues and proprioceptive issues. We can also set up some obstacle courses in a nice safe space using some of the mats that are here. We also use the poles and the mirrors so that they can also see themselves when they're doing it, just to improve on their balance and proprioception.
Welcome to our gym facility. Right, and over here we've got our equipment paradise. We've got high-tech equipment supplied by TechnoGym that we use to train every body part possible. The small muscles, the big muscles, the little muscles. We've got a recumbent bike over here. We've got the upright bicycle. We've got treadmills. Plenty equipment that we use to train our gym members, to train our patients. Over here we've got Peter using body weight equipment. So we've got the mats to do our body weight exercises. We've got plinths in case individuals cannot get down on the ground. They can perform the exercises over there. We've got some of our free weight equipment over here. Peter demonstrating a few exercises because we like to keep things exciting for our students, for our patients, and for our gym members. Right, we also got very exciting plyometric equipment. Over here we've got our hurdles. We've got stuff to train proprioception and balance, such as our foam mat as well as our Bosu ball. We try and incorporate every type of exercise, exciting, new, different, we've got it all. Right, so upon access, we have our access for our patients as well as for our individuals with disabilities. Over on this side, we have our emergency tools. So what to do in an emergency, just giving us instructions on what to do. We've got our fire extinguisher in cases of fires, as well as with the relevant button to make the entire building aware that there is trouble and danger. We've got our defibrillator over here in cases of emergency. individual that's a staff member has the relevant training, first aid training in cases of emergency. Our gym is also equipped with a Wi-Fi router so that we have access to Wi-Fi. It is a well-lit area with lights, as well as a well-ventilated area because we are equipped with air conditioning systems as well as windows. Okay, we are now in Umpilo block, the first floor. This is where we have access to our lecture rooms where students come up for their lectures. We have 3 lecture rooms, 1 over here and 2 further up the passage. We also, on our right, we have our postgraduate room where students can come and just be millennials, do their research as well as studying.
Alright, so I'm just going to take you guys through one of the lecture rooms. So over here, starting with the ventilation of the room, as you can see, each lecture room is equipped with fans, and then we also have windows available so that there is adequate ventilation in the rooms. Going on to the audio-visual equipment for teaching the students, we have a main projector over here, as you can see, hanging from the ceiling. And then in case of emergencies, we also have an overhead projector there in the corner, in case you want to go old school. We also have speakers in each corner of the room, so that in case we want to play a video, we can show the students over there. We also have the Wi-Fi router available for internet connection, so we can do Pole EV, so that we can interact a bit with the students with our digital projector, so that whenever we're doing a topic discussion, we can invite the students to go onto a poll, we can access there, and then the students can see what each of them are really saying using the digital projector on the top. So with our seating plan in each lecture room, even though each lecture room is the same, we can customize the number of seats available in each room to accommodate any course that we do want to lecture in one of the lecture rooms available. Okay, so we're now upstairs here by the lecture staff members' offices. So as you can see, we are at the beginning now, the reception. This is where people can just come in and just inquire any queries that they need to, with the receptionist usually behind the office and the door space there. Then we also have our lecture staff members' offices over here, as you can see on my left. So as you can see behind me, we have additional offices available for the other lecturers. We also have 2 additional consultation rooms available for any patient that wants to come in. Okay guys, so this is now the pool that we use here to do some activities with our students and our patients. So I'm just going to talk a little bit about what we use the pool for group class activities such as water aerobics for just the general gym members, and then for our patients we incorporate land and water based activities just so they can get the best out of the rehab program to improve their strength and their function and their functional capacity.
Right. And for the students, we try and involve them within the group classes, so the other students will be involved in either conducting as well as joining some of the group classes, which would obviously be water aerobics, as well as teaching them the fundamentals of hydrotherapy.